Hey VCE HHD students, my name's Andy. I'm a VCE Health and Human Development teacher. In this short video, I'm going to look at answering the 2021 VCE HHD exam, question number 10. Before we dive into question number 10, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to get access to all of those videos. You can see our social media links there if you'd like to follow us, and also our email if you've got any questions or suggestions for videos you'd like me to work on. Now you can see here, question 10 in the 2021 exam was a 6-mark question, and it started with some stimulus material regarding the Be Healthy, Be Mobile initiative. So it said 96% of the world has access to mobile phone networks. The Be Healthy, Be Mobile initiative uses mobile phone technology to deliver disease prevention and management information direct to mobile phone users and strengthens health systems by providing training to healthcare workers. So following that, the question was, the Be Healthy, Be Mobile initiative implemented by the WHO was introduced to address the incidence of non-communicable diseases, analyse the implications of the Be Healthy, Be Mobile initiative for health and well-being. So with a question like this, okay, you can see obviously it's asking you to analyse. So often that is asking you to look at both sort of sides of the equation, so sort of advantages and disadvantages. So you could have looked at both sort of positives and negatives in relation to this initiative, and it's asking you to link it to health and well-being. So that's obviously dimensions of health and well-being. And for 6 marks, I think you'd want to be linking to at least 3 dimensions of health and well-being. So you can see here it was difficult for students to achieve full marks for this question in 2021, with only 1% of students being able to do so. It mentions there that it was not asking students to evaluate the program or to analyse impacts of lack of access to mobile phone networks. So this means you should really always read that stimulus material closely, okay, because it helps to guide your answer. It says that the stimulus material indicated there was potential for positive outcomes, yet some students only discuss limitations. And so although potential negative impacts could be included in the response, if it only discussed limitations, you weren't eligible for full marks. So as I said, you really need to look at the stimulus material and think about the way in which it's framed and what it's really focusing on. So they gave you there an example of a possible response. So this student here said that the 96% of the world's population having access to these platforms, such as the Be Healthy, Be Mobile initiative. That means a greater number of people across all income countries have the ability to increase their health knowledge, and that creates a more informed population. And then they gave an example. They said a person diagnosed with heart disease could access the initiative via their mobile phone, and tailored advice could be delivered directly to mobile phone users on risk factors such as diet and exercise, and that could be provided to the individual, and that could increase their self-confidence and their ability to manage their disease, and that can increase self-esteem and resilience. So you can see a couple of dimensions are sort of linked there. It says with increased exercise, individual can increase their fitness and healthy body weight, so that's obviously linking to physical health and well-being, and it provides training to healthcare professionals, and that builds the knowledge and skills via effective communication. Okay, results which could be part of this sort of partnership. So it also mentions towards the end there that some individuals may choose not to subscribe to the initiative due to concerns that their private information could be hacked by dishonest people, and so their health and well-being may not improve. So they did sort of consider, I guess, how the initiative isn't always going to be 100% positive for all people. So some of that balance was present in their answer there. So this is definitely a good question to go back and practice in the lead up to the exam this year. Okay, hopefully you found that useful. A reminder, the Health Resource Hub YouTube channel, our social media links, and our email. Thanks so much.